Nurse Aide Test Prep Book free. Question 1. Range of motion, ROM, exercises are performed to: Option A, build muscle strength. Option B, prevent contractures and maintain joint mobility. Option C, increase weight. Option D, decrease appetite. The correct answer is option B, prevent contractures and maintain joint mobility. ROM exercises prevent contractures, permanent shortening of muscles, and maintain joint mobility. They are important for clients with limited mobility. Question 2. A client who is confused becomes agitated. The nurse aide should: Option A, give the client a sedative. Option B, remove the client from the situation. Option C, use a calm, reassuring voice. Option D, tell the client to calm down. The correct answer is option C, use a calm, reassuring voice. A calm, reassuring voice can de-escalate agitation. Sedatives require an order. Removing the client may be necessary if they are a danger to self or others. Telling someone to calm down often has the opposite effect. Question 3. To prevent skin breakdown, the nurse aide should: Option A, keep the skin clean and dry. Option B, keep the skin moist with lotion. Option C, rub bony prominences vigorously. Option D, use only powder on the skin. The correct answer is option A, keep the skin clean and dry. Clean, dry skin is the first line of defense against pressure ulcers. Moisture from sweat, urine, or feces softens skin and increases friction. While lotion is important, too much moisture is harmful. Rubbing vigorously damages tissues. Question 4. How should the nurse aide shave a client who takes blood thinners? Option A, with a straight razor. Option B, with an electric razor. Option C, with a safety razor. Option D, the same as any other client. The correct answer is option B, with an electric razor. Clients on blood thinners are at increased bleeding risk. An electric razor is safest because it reduces the risk of skin cuts. Straight and safety razors can cause nicks that bleed excessively. Question 5. What should the nurse aide do if a client begins to choke during a meal? Option A, call for help. Option B, perform the Heimlich maneuver. Option C, pat the client on the back. Option D, give the client water. The correct answer is option B, perform the Heimlich maneuver. If a client is actively choking, unable to speak, cough, or breathe, perform the Heimlich maneuver immediately. Calling for help can be done simultaneously. Patting the back is not the recommended primary intervention. Giving water can worsen obstruction. Question 6. What should the nurse aide do first for a client who has fallen? Option A, move the client to their bed. Option B, assess for injury and call for help. Option C, document the fall. Option D, call the client's family. The correct answer is option B, assess for injury and call for help. Assess for injury while calling for help. Moving without assessing could worsen injuries. Documentation and family notification are secondary. Question 7. The nurse aide is performing perineal care on a female client. The aide should: Option A, wipe from front to back. Option B, wipe from back to front. Option C, wipe in circular motions. Option D, wipe in any direction. The correct answer is option A, wipe from front to back. For females, wipe front to back, vagina to rectum, to prevent introducing fecal bacteria into the urethra or vagina. Back to front increases infection risk. Question 8. A client who is anxious and pacing should be: Option A, placed in a chair and restrained. Option B, encouraged to talk about what is bothering them. Option C, given a sedative. Option D, ignored until they calm down. The correct answer is option B, encouraged to talk about what is bothering them. Encouraging the client to talk about their concerns helps identify the cause of anxiety and may provide relief. Restraint is inappropriate for anxiety. Sedatives require a physician's order. Ignoring them leaves them to suffer alone. Question 9. The proper body mechanics for lifting includes: Option A, lifting with the back. Option B, lifting with the legs. Option C, twisting while lifting. Option D, lifting with arms extended. The correct answer is option B, lifting with the legs. Lifting with the legs, bending at the knees, keeping back straight, uses the strongest muscles and prevents back injury. Lifting with the back is a common cause of injury. Twisting while lifting puts torque on the spine. Question 10. When making an occupied bed, the nurse aide should: Option A, roll the client side to side, working with one side at a time. Option B, have the client sit in a chair. Option C, make the bed with the client on one side only. Option D, ask the nurse to help. The correct answer is option A, roll the client side to side, working with one side at a time. Making an occupied bed involves rolling the client to one side while changing linens on the opposite side, then rolling to the other side. Having the client sit in a chair is for an unoccupied bed change. Question 11. When dressing a client with a weak right arm, the nurse aide should: Option A, dress the right arm first. Option B, dress the left arm first. Option C, dress both arms simultaneously. Option D, dress the stronger arm first. The correct answer is option B, dress the left arm first. Dress the stronger arm, left, first, then the weaker arm, right. This minimizes discomfort and strain on the weak arm. Dressing the weak arm first would require moving it more. Question 12. When taking a client's oral temperature, the nurse aide should place the thermometer. Option A, under the tongue. Option B, on top of the tongue. Option C, between the cheek and gum. Option D, under the arm. The correct answer is option A, under the tongue. The sublingual pocket under the tongue is the correct placement for an oral temperature. This area provides accurate core temperature readings. Placing on top of the tongue or between cheek and gum does not provide accurate readings. Under the arm is the axillary method, not oral. Question 13. A client is angry and yelling. The nurse aide should: Option A, yell back at the client. Option B, leave the room and return later. Option C, listen to the client's concerns and remain calm. Option D, call security. The correct answer is option C, listen to the client's concerns and remain calm. Active listening without defensiveness de-escalates anger and shows respect. Yelling back escalates. Leaving may be necessary if the client is a danger, but listening is the first approach. Security may be needed if the client is a danger to self or others. Question 14. If the nurse aide observes a change in a client's condition, the aide should: Option A, document it in the chart. Option B, report it to the nurse immediately. Option C, wait to see if it gets better. Option D, ask the client's family what to do. The correct answer is option B, report it to the nurse immediately. Changes in a client's condition must be reported to the nurse immediately for assessment and intervention. Documentation can follow, but reporting is the priority. Waiting could allow a serious condition to worsen. Question 15. A client has had a stroke and has left-sided weakness. The nurse aide should: Option A, place items on the left side to encourage use. Option B, place items on the right side where the client can reach them. Option C, ignore the weakness. Option D, restrain the left arm. The correct answer is option B, place items on the right side where the client can reach them. Place items within reach on the stronger side to promote independence. Encouraging use of the weaker side is appropriate but should not be forced. Restraining is not appropriate. Question 16. A client at risk for pressure ulcers should be repositioned how often? Option A, every hour. Option B, every 2 hours. Option C, every 4 hours. Option D, once a shift. The correct answer is option B, every 2 hours. Clients at risk for pressure ulcers should be repositioned at least every 2 hours to relieve pressure on bony prominences. Repositioning every 4 hours or once a shift is insufficient. Question 17. A client with dementia has a tendency to wander. The nurse aide should: Option A, place the client in a locked room. Option B, provide a safe wandering area. Option C, use restraints. Option D, ignore the behavior. The correct answer is option B, provide a safe wandering area. A safe, enclosed area for walking addresses the need to wander safely. Locked rooms and restraints are restrictive and require orders. Ignoring the behavior is unsafe. Question 18. Normal adult resting heart rate range is: Option A, 40 to 60 beats per minute. Option B, 60 to 100 beats per minute. Option C, 80 to 120 beats per minute. Option D, 100 to 140 beats per minute. The correct answer is option B, 60 to 100 beats per minute. The normal resting heart rate for adults is 60 to 100 beats per minute. Rates below 60 may be normal for athletes but are considered bradycardia. Rates above 100 are tachycardia and require reporting. The other ranges are outside the normal adult parameters. Question 19. What is the correct position for a client receiving oral care to prevent aspiration? Option A, supine position. Option B, Fowler's position. Option C, prone position. Option D, Sims position. The correct answer is option B, Fowler's position. Fowler's position, semi-sitting, prevents aspiration by allowing gravity to aid swallowing. Supine, flat, increases aspiration risk. Prone is not appropriate for oral care. Sims is used for enemas and rectal procedures. Question 20. The compression to ventilation ratio for adult CPR, single rescuer, is: Option A, 15:2. Option B, 30:2. Option C, 5:1. Option D, 10:1. The correct answer is option B, 30:2. For adult CPR by a single rescuer, the ratio is 30 compressions to 2 breaths. This is the American Heart Association standard for effective CPR with minimal interruption. Question 21. The best way to communicate with an unresponsive client is to: Option A, avoid talking to them since they can't hear. Option B, speak to them as if they can hear and respond. Option C, speak loudly near their ears. Option D, only speak to family members. The correct answer is option B, speak to them as if they can hear and respond. Many unresponsive clients can still hear and may benefit from hearing familiar voices. Speak calmly, explain procedures, and use the client's name. Hearing is the last sense to go. Question 22. A client with dementia frequently repeats the same question. The nurse aide should: Option A, explain that they already answered the question. Option B, answer the question patiently each time. Option C, ignore the question. Option D, write the answer on a whiteboard. The correct answer is option B, answer the question patiently each time. Repetitive questioning in dementia clients is due to short-term memory loss. Answering patiently each time shows respect and reduces anxiety. Explaining that the question was already answered frustrates the client who cannot remember. Question 23. A client's blood pressure reading is significantly different from the previous reading. The nurse aide should: Option A, ignore the difference. Option B, recheck it after 1 to 2 minutes. Option C, change the client's medication. Option D, document the first reading only. The correct answer is option B, recheck it after 1 to 2 minutes. When an unexpected reading is obtained, recheck after 1 to 2 minutes. The client may have been talking, anxious, or the cuff may have been positioned incorrectly. CNAs cannot change medications. Documenting only the first reading without confirming would be clinically incorrect. Question 24. A client expresses fear about an upcoming procedure. The nurse aide should: Option A, tell the client not to worry. Option B, acknowledge the fear and offer support. Option C, change the subject. Option D, tell the client the procedure is minor. The correct answer is option B, acknowledge the fear and offer support. Acknowledging and validating the client's fear provides emotional support. Dismissing or minimizing the fear, A, D, is not therapeutic. Changing the subject, C, avoids the client's concern. Question 25. When caring for a dying client, the nurse aide should: Option A, keep the client's room dark and quiet. Option B, allow the client to express his feelings. Option C, change the subject if the client talks about death. Option D, contact the client's minister, priest, or rabbi. The correct answer is option B. Allow the client to express his feelings. Allowing a dying client to express feelings about death and dying is essential for emotional support. Changing the subject or avoiding the topic is inappropriate. Keeping the room dark is not necessary and may increase isolation. While offering spiritual support is appropriate, the aide should not assume the client wants clergy contacted without asking first.